there are different imaging modalities to look for gynecological pathology. The most accessible tool is of course the in-office gynecological ultrasound. It's a very user-dependent technique, and it is very necessary to have a standardization in the way you describe your ultrasound findings and also the way you measure your findings. And depending on a standardized definition and measurement methodology, you can have the possibility to use diagnostic methods. For instance, in the International Ovarian Tumor Analysis Group, there are tools to assist clinicians in improving the diagnosis. For instance, the simple rules or the next model. It is a possibility to have an instant diagnosis at the moment you're seeing the patient. More of these methods will follow, as more recently there is an endometrial group, IETA group, a myometrial group, so the MUSA group, and the endometriosis group, the IDEA group. Here as well, standardized definitions have been published and prospective studies are ongoing to, in the future, develop diagnostic methods to improve diagnosis of other gynecological pathology. So with a minimal amount of training, a basic training, every investigator, irrespective of the experience, will be able to improve the diagnosis. Of course, in some cases there will be an unclassified diagnosis, or there will be cases where you need some other testing, and in that case it will be merely MRI, which will be promising because it's also a not harmful method, for instance, as opposed to CT scan where you have X-ray exposure to the patients. Besides that, there are with ultrasound some more interventional or methods to look, for instance, for tubal patency testing with foam contrast ultrasound. But also ultrasound will allow you, for instance, to do biopsies of lesions that you cannot characterize, or do punctions of cysts which cause symptoms. So it's not only about diagnostics, but there's also a very close connection to possible therapeutic strategies using this procedure.